Our knowledge about COVID-19 is rapidly changing. You may think that life is somewhat getting back to normal, but it's not. Our new normal now involves COVID-19. COVID-19 is a danger to your health and those who are around you. COVID-19 is just not some flu that will go away like it's nothing, but could hurt you in many different ways. Our knowledge about COVID-19 is changing. Today I'll be talking about these 3 points: masks, quarantine, and cleaning. Let's start with masks. According to Mayo Clinic, face masks combined with other preventive measures such as frequent hand washing and social distancing help slow the spread of the virus. For myself personally, I think masks are very effective because it ensures my safety from others who might have COVID-19 or ensures other safety from me. According to Mayo, wearing a face mask is one of the most effective ways to prevent spread of the virus. In public, you see a majority of people wearing masks, but there's still a handful of people who still don't wear them and think the pandemic is fake. The face masks help us to make sure that we're safe and prevent us from catching COVID. It might not be 100% effective, but it's still effective in many different ways. Quarantine is a very effective way of being safe as well. According to Lisa Lockard, quarantine is used to keep someone who might have been exposed to COVID-19 away from others. Quarantine helps prevent spread of diseases that can occur before a person knows they are sick if they are infected with the virus without feeling some symptoms. Quarantine has benefited my family, and when we thought my dad was exposed to COVID-19, and having my dad away from us minimized any exposures he could have had or could have gotten sick, but we didn't. According to Lisa Lockard, quarantine helps prevent spread of disease that can occur before a person knows they are sick or if they are infected with the virus without feeling symptoms. In many different aspects, not exposing others in the pandemic by staying home when they feel sick is a very good idea of quarantine, especially now that the flu season is upon us and can possibly get worse. We've talked about wearing masks and quarantine. Now for my third and final point, which is cleaning. According to the Center for Disease Control, frequent hand washing and social distancing help slow the spread of the disease. Whenever it was mine or my siblings' turn to bring food or anything to my dad, we'd wear our gloves, face masks, and then put it in front of his door, then run down the stairs, take off our gloves, and wash our hands for extra protective measurements. Once again, according to the Center for Disease Control, cleaning does not kill germs, but by removing them, it lowers the numbers and the risk of spreading infection. If a surface may have gotten the virus on it from a person with or suspected to have COVID-19, the surface should be cleared and disinfected. Disinfecting kills germs on surfaces. During the time we thought my dad had COVID-19, we were disinfecting everything, and when he got home, we all ran to our rooms and waited for him to get to his. When he finally got to his room, we disinfected the doors, the doorknobs, and everything else he touched to ensure our safety. Our knowledge about COVID-19 is rapidly changing. I've talked about these 3 points: masks ensure our safety and your safety in public places and anywhere. I've talked about quarantine. If you're feeling sick, staying home and being away from others can ensure everyone's safety. And cleaning, disinfecting your whole house and wash your hands when you go anywhere or having guests ensure your safety. Being safe, such as wearing masks, washing your hands, staying home and sick, helps keep everyone safe, including yourself. COVID-19 is changing.